Hi, we are Carla Valentina, Ariadna Monroy, Alejandro Garduza, Hugo Kanga, and Hector Ruben, and today we are going to talk about the birth control. Well, first of all, why we choose birth control and why we think that it's important. Well, I think that it's important because it helps you to prevent a pregnancy, and not also a pregnancy. It also can prevent um, um, sexual AIDS and sexual disease that you can have without some if you don't have some care for your body. Well, what is a birth control? Well, a birth control is the use of practice and methods or device to prevent pregnancy from occurring in a sexually active woman, or even and
Voz de tutorial.
Hey, so I'm Hugo. I'm going to explain the natural methods. So, those are the pulling out, the calendar checking, and the abstinence. Two of those, one of those is really not so effective. Like the pulling, which is the pulling out method. Because even though there's no semen inside the female's body, there is still a sperm inside the pre-ejaculatory liquid. But going even further, pulling out, getting the penis inside the vagina without any kind of protection is really dangerous, because it doesn't give you any kind of protection or security against STDs or any type of infections. The calendar, it's sometimes effective because it depends on the regularity of the woman. Even though you are so sure that at that and that types of times the woman will not have any type of ovulation or whatever, it could still happen. So it's not 100% sure or secure. The same with the STDs and whatever, because you are doing it without any type of protection. There's no security against STDs. And the other one is the abstinence. The abstinence is 100% sure against some types of STDs, not those ones which include the lips or the faces, because those could still be transferred. But from the vast majority, that is because there is no kind of sexual interaction or intercourse between people. But if you are like having the necessity, you will not see it satisfied. So it would also not be a recommendation.
Well, I'm going to talk about the permanent methods. First, the vasectomy. Well, basically, it gets your sperm out of your semen by cutting each vas the first tube. This method is nearly 100% effective, but keep in mind that the vasectomy doesn't protect you from the STDs. You will still need to use another barrier method, as the condoms. The vasectomy can cost an average of 20,000 pesos, but many times in public hospitals, this surgery is done for a lower cost or even for free. But for women, what options exist? Well, the tubal ligation is the one. It prevents an egg from traveling from the ovaries through the fallopian tubes and blocks the sperm from traveling up the fallopian tubes to the egg by blocking or removing the fallopian tubes. Although it's 100% effective, you will still need to use another method for prevent you from the STDs. The most used are the hormonals, as the UTE or the patch. The cost of this surgery can be between 0 to 120,000 pesos, including following visits, depending on the hospital you decide. Well, that's the only method that exists, and my partners are going to talk about the blocking methods and hormonals.
We're gonna talk about the barrier methods. We have male and female condom. Okay, so the first one, the male condom, can help you avoid getting your couple pregnant. It also helps you not having ITS, and it has a 95% chances to work. It's also so simple to use. When your penis is erect, you pull down the condom into the penis. This before the penetration of the vagina. It's also one of the cheapest methods in the list. You can buy it at any pharmacy at 30 pesos a box. Usually, this method is used with a spermicide. But not only men can have condoms, also women. And it works exactly the same, with a 95% chances of working and not giving you an ITS. The way to put this condom is by pushing the condom into the vagina until it fits. Unfortunately, you can only get this via online shops, and the cost might change. Warnings: never use both male and female condoms at the same time. 2. Never use 2 condoms at the same time. 3. Pregnancy can still happen. And 4. They can and must be used only once.
Now I'm going to talk about other methods. First, we have the IUD. It's a tiny device that's put into your uterus to prevent the pregnancy. This one is the most effective, and it's one of the priciest methods, upfront costing around $900, and it is 99% effective. So you can prevent a pregnancy around 3 to 12 years. Then we have the birth control patch. This one stops the fertilization by releasing hormones through your skin that prevents pregnancy. It is used once a week, and it may have side effects like skin irritation, headaches, irregular vaginal bleeding, and you can get it patch by a low price of $30. And by the way, you will need a prescription from your doctor, and this method is 91% effective. That's all.